everyone, welcome back to my YouTube channel, Midcode Education. So, in this video, I am going to discuss about the CPC mock question paper. Okay, so here I'm introducing some more questions related to CPC examination, most repeated in CPC examination. Okay, so let us go through first of all digestive system. Okay, so mm I'm just explaining the questions and options only. So you can just solve the questions in yourself and send me through my email. Okay, my email is medcodeeducation10@gmail.com. Okay, so okay guys, these are some more questions. So here the question is about digestive system. Dr. Barnes excised a 4 centimeter esophageal lesion with primary repair. To excise the lesion, Dr. Burns made an upper midline abdominal incision to access the esophagus. The surgical site was closed with two layers of sutures. What code indicate this services? So this is the question, and also some options are here. Just go through all the options and take the appropriate code. Okay. And 46, a patient present with gastroesophageal reflux disease. To treat this disorder, the surgeon performs a laparoscopic Nissen procedure. Okay, a diagnostic laparoscopy was completed during the same session. What code indicate the service? Here they have mentioned laparoscopic Nissen procedure. Okay, so also options are there. Try to find out the correct answer. 47. Sam, a healthy 32-year-old male, is scheduled for surgery. He has no systemic diseases, doesn't smoke, and regularly exercises. He is prepared and taken into operating room. The surgeon performs an endoscopic retrograde mm, cholangiopancreatography with endoscopic retrograde insertion of nasobiliary drainage tube. Within the same operative session, the surgeon also performs a sphincterectomy. How would you code this service? Also, options are there 43267 P1 and 43260. 43267 modifier 51, 43262 51, 4327, 43262 modifier 51, 43274. Okay, so try to do yourself. Next is Jim present to Dr. Martin's office with severe abdominal pain. Dr. Martin has not Essex made a definitive diagnosis. He scheduled Jim for diagnostic laparoscopy. He notices Jim has a vermiform appendix. Dr. Martin removed the appendix and laparoscopy. The final diagnosis is appendicitis. What code capture these services? Okay, so solve yourself. Mhm. Modifier 51 is there. It's a common modifier used in this procedure. So check the every codes and try to solve it. Okay. No need to comment in comment section. Okay, because everyone copying your answer. So that's why I'm requesting to just send me through my email this answers. Okay. And one more thing, today is the last day for our giveaway. Okay, I will announce the winners in the next video. So, I mean next day. Okay, so today is the last video for your today is last last day for your giveaway. So if anyone interested to join our giveaway, just go through the questions and answer me, answer yourself and send me through my email ID. Okay. Yeah. Next is 49th question. Dr. Mist performed the following procedure on patient: a flexible diagnostic colonoscopy with collection of 8 specimens by brushing in the morning. Later the same day, the patient had a diagnostic upper gastrointestinal endoscopy EGD, including the esophagus, stomach, and the jejunum with transmural drainage of pseudocyst. This procedure were not staged or related and occurred during different sessions. What codes capture this procedure? Okay, solve this. Also, specimen they have mentioned in our option. They have mentioned space number of specimens also. So go through this all the codes, dears. Is it clear for you guys? Mm, yeah. I will share maximum questions for your help. Okay, share maximum questions. I will upload lot of questions for you guys. You don't need to worry about CPC examination because it was easy, but it's a challenging. Okay, so with your skills and abilities, is there? It's a technique and also time management. This is the main thing related to the examination. So you have to prepare yourself, practice well. Okay, if you get a good score in CPC examination, okay. 15th one, Dean lost his teeth in an auto accident 1 year ago. He has had several facial surgeries to restore his nasal function and rebuild the orbit of his eye and cheek. Currently, he is scheduled for a posterior complex vestibuloplasty with muscle repositioning. What code capture the current procedure? So 40845, 40843, and modify 52, 40842, 40845, 40899. Okay. So next is we are moving on to urinary male and female reproductive system. Okay. In this chapter, 51. Okay, both female and male reproductive system urinary related chapter. Mary underwent a bilateral vulvectomy with removal of 92% of the vulvar area. Also had an inguinofemoral lymphadenectomy during the same operative section. Code capture the service is a most important and repeated question. Okay, most important and repeated question. So just highlight this. Okay, most repeated and also direct question. Next is question number 52. A physician performs laser vaporization of the prostate with a vasectomy. The patient had some postoperative bleeding that was controlled at the time of the procedure. What could capture the service? 52648, 52601, 52648, 52647, 52601, 52448, 54162. Okay. Yeah. Move on to next question. Uh, Cheryl is a 36-year-old established patient with Dr. Win, an OBGYN. During Cheryl annual physical examination, Dr. Win noticed a lesion on the perineum. After completing the annual exam, Dr. Win biopsy 5 lesion on the perineum. Now, should his office code the service for the biopsy? It's a biopsy related question. Okay. Mm, solve it. Next is mixture bill has a urinary incontinence. The urologist performs anterior anterior vesicrothraxopexy to correct the incontinence. Okay, the physician documented that this was a complicated repair. Actually, the procedure was too length. The procedure anterior vesicrothrapoxy. Okay, so so difficult to pronounce also. But the code is very easy and simple code. It's a one code. Okay, so simple thing. Okay, this is the procedure to find out the code for this procedure only. So 51840, 51841, 53440, 53899. So very important question and also easy question. 51. How would Dr. J report her services for an injection procedure for retrograde cystography with radiological supervision and interpretation? She completed this procedure in a hospital surgical suite. 51610, 51610, 7443026, 51605, 74450, 51610, 74450. Next is Mrs. Johns is pregnant with twins. She has been with the same obstetrician, Dr. Green, for her entire pregnancy. Now, Mrs. John is ready to deliver. Dr. Green helped Mrs. John deliver her twins vaginally. So, what is the code? So, twins they are delivered through vaginally. So, both are vaginal delivery. So, how to code? Okay, how to code? This is also important. Nervous system related 60K series. Todd was in motorcycle accident. He suffered multiple fractures and laceration during one surgical session. A surgeon elevated a depressed skull fracture. This procedure required repair of the dura. What code capture the services? So here is what is the procedure they have mentioned, you know, they have mentioned he suffered multiple fracture and laceration. One surgical section, surgeon elevated depressed skull fracture. Okay, depressed skull fracture. The procedure required repair of the dura. So here the procedure repair of the dura was done by the surgeon. Okay, repair of the dura was done by the surgeon. Clear? So this is the procedure. So it's also simple and direct question. Yesterday, someone asked me to share some more question documents, ma'am. Okay, so that is why I am sharing now, like a video. Okay, live stream video. Thank you for all the support, guys. I will get more compliments and more feedback, good feedback, good comments from your side. I'm so happy to share my knowledge to yourself. Okay, 58. A physician obtained corneal tissue from an eye bank and sizes the tissue for transplant. The physician then perform a lamellar keratoplasty. He removes the anterior layer of the diseased cornea and replaces it with the prepared donor tissue. What are the correct code for these services? 59. Mr. Keller had a 6 centimeter neoplastic lesion at the base of the anterior cranial fossa. Excised the lesion was not connected to the dura mater. Dr. Robert, a neurosurgeon, excised the lesion. Dr. Reed performed an extradural craniofacial approach to the anterior cranial fossa without orbital exenteration. What is the correct code for the excision procedure? 16th one. Today, Terry had a re-exploration procedure of the thoracic region of the spine. This procedure is rarely performed but has FDA approval. Terry has signed extensive consent forms and understand the risk involved. She and her surgeon believe this procedure might offer her pain relief. What is the correct code for this service? 3-1. 2-year-old Bobby was running through the house with a popsicle when he fell, suffering a 3 centimeter partial thickness laceration to his left upper eyelid. This injury involved the lid margin and tarsus. Bobby was taken to an emergency room by his parents, and the physician did a direct layered closure. How would you code the physician services? Also, in the options, you can see E1, LT, E1, E1. Okay. So, LT means left. Mm? Okay. So, 12052, 12002. Option A and B is in integumentary system related. Okay. Uh, 10K series question, and others are 60K. 62. A physician exercised multiple chalations on bilateral eyelids. The procedure required general anesthesia. At the same session, the physician excised another non-chalation lesion on the right eyelid, which required simple closure. What codes correctly capture the surgeon's services? Actually, the question is simple, small question, but the options is bigger. Okay. Try to study the modifiers, dears, because modifier is very important, because modifiers and the explain description of modifiers, because a little mistake make your CPC score less. Okay, so try to by heart the concept of modifiers. It is very essential for your examination. Okay. Next is E&M. E&M is a very toughest chapter for me. Okay, not only yours, but for me, E&M is a little bit tougher. because the way of identifying the code is very tough for myself. That's why I'm sharing my experience to you guys. The question is, yeah, the main difference in E&M and other chapter is, in E&M the question is too long, too big question, but the answer is very, very, very short. Okay, but others the question is very short, but the answer is very too long. Okay, so here you have to understand first thing that procedure, the way attended or go back to office and went to home, everything consulting related things you have to notice everything, each and everything. Okay, the concept, first of all, here the concept is very important. Miss Fisher was referred by his internist to a surgeon's office for a consultation regarding hemorrhoids. The surgeon noted the request for consult in his medical record and sent a letter back to the referring physician. The surgeon completed a detailed history, detailed examination, and low decision making. The surgeon recommended medical treatment and prescribed two different ointments and an oral medication. He suggested re-evaluation if the hemorrhoids caused Mr. Fisher problems in the future or if he continued to have active symptoms. What could correctly capture the surgeon's services? This is the question. So, here 99243 is option A, option B 99241, option C 99203, and option D 99214. 64. Dr. Lyon was called the critical care burn unit to see a 50-year-old patient who suffered third-degree burns to 30% of her body. Dr. Lyon spent 2 hours and 40 minutes with this patient, her family, and coordinated care with other specialists. He made several phone calls from the unit on her behalf and consulted with the nursing staff. During this time, Dr. Leon provided ventilator management and gastric intubation. What could correctly capture Dr. Lyon's services? Also, in this option, you can see option A and option B indicated that other chapters codes also. Okay, so look at this codes and the descriptions. Read the question first of all. Only after that, you have to check the options. Okay. 65. Etna, an 80-year-old patient, had a stroke with late effect hemiplegia to her dominant side. She was transferred from the hospital to a nursing facility. Dr. George, an internist, is called to see Etna and provides a multi system examination, comprehensive history, and reviews an extensive amount of data. She documents the high risk of complications due to extensive medications and management of multiple systemic diseases. Dr. George talks with a multidisciplinary rehabilitation team regarding Etna physical activities, including plan for physical therapy. What are the correct codes for Dr. George visit? So here they have mentioned Dr. George visit code. So just read the way of Dr. George. Okay, he came all the time and all the procedure he had done, and the examination result, it's a comprehensive and high risk of complications, so everything, just read the concept of Dr. George visit. Next is 66. Alex moved back to the area after being out of state of 6 years. He returned as a patient to Dr. Ben, his previous internist. Dr. Ben sees Alex in the office for an evaluation of his asthma. Dr. Ben documents a detailed history, detailed examination, and decision making of low complexity. Several hours after Alex left the office, he returns because he is having difficulty breathing and has hives after using his new inhaler. Dr. Ben admits Alex to the hospital. He dictates a comprehensive history, comprehensive examination, and high decision making in the admission report. Additionally, Dr. Ben instructed his staff to fax a copy of his office not to include in the hospital record for admission. What could correctly capture Dr. Ben's service? Okay, guys. So this is enough for today's live. I will be back on more videos and more questions, more answers, more medical coding related things in the next video. Thanks for watching, guys. Thank you for your all